Healthcare in Switzerland is universal and is regulated by the Swiss federal law on health insurance. There are no free state-provided health services, but private health insurance is compulsory for all persons residing in Switzerland. International civil servants, members of embassies, and the family members are exempted from compulsory health insurance. Requests for exemptions are handled by the respective cantonal authority and have to be addressed to them directly. The whole healthcare system is geared toward the general goals of promoting general public health and reducing costs while encouraging individual responsibility. Health insurance covers the costs of medical treatment and hospitalization of the insured. However, the insured person pays part of the cost of treatment. This is done by means of an annual deductible, which ranges from 300 Swiss francs to a maximum of 2,500 Swiss francs for an adult is chosen by the insured person and by a charge of 10% of the costs over and above the excess up to a stop-loss amount of 700 Swiss francs. Switzerland has an infant mortality rate of about 3.6 out of 1,000. The general life expectancy in 2013 was for men 80.5 years compared to 84.8 years for women. These are among the world's best figures. Compulsory coverage and costs. Swiss are required to purchase basic health insurance, which covers a range of treatments detailed in the Swiss federal law on health insurance, French, la loi fédérale sur l'assurance maladie, Italian, Legge federale sull'assicurazione malattie. It is therefore the same throughout the country and avoids double standards in healthcare. Insurers are required to offer this basic insurance to everyone, regardless of age or medical condition. They are not allowed to make a profit off this basic insurance, but can on supplemental plans. The insured person pays the insurance premium for the basic plan up to 8% of the personal income. If a premium is higher than this, the government gives the insured person a cash subsidy to pay for any additional premium. The universal compulsory coverage provides for treatment in case of illness or accident and pregnancy. Health insurance covers the costs of medical treatment and hospitalization of the insured. However, the insured person pays part of the cost of treatment. This is done by these ways: by means of an annual excess, which ranges from 300 Swiss francs to a maximum of 2,500 Swiss francs for an adult is chosen by the insured person, and by a charge of 10% of the costs over and above the excess. This is known as the retention, and is up to a maximum of 700 Swiss francs per year. In case of pregnancy, there is no charge. For hospitalization, one pays a contribution to room and service costs. Insurance premiums vary from insurance company to company, the excess level chosen, the place of residence of the insured person, and the degree of supplementary benefit coverage chosen. In 2014, the average monthly compulsory basic health insurance premiums in Switzerland of the following: 396 Swiss francs and 12 Rappen for an adult, 363 Swiss francs and 55 Rappen for a young adult, 91 Swiss francs and 52 Rappen for a child. Private coverage. The compulsory insurance can be supplemented by private complementary insurance policies that allow for coverage of some of the treatment categories not covered by the basic insurance, or to improve the standard of room and service in case of hospitalization. This can include complementary medicine, routine dental treatments, half private or private ward hospitalization, and others, which are not covered by the compulsory insurance. insurance. As far as a compulsory health insurance is concerned, the insurance companies cannot set any conditions relating to age, sex or state of health for coverage. Although the level of premium can vary from one company to another, they must be identical within the same company for all insured persons of the same age group and region, regardless of sex or state of health. This does not apply to complementary insurance, where premiums are risk-based. Organization. The Swiss healthcare system is a combination of public, subsidized private and totally private systems. Public, e.g., the University Hospital of Geneva with 2,350 beds, 8,300 staff and 50,000 patients per year. Subsidized private, the home care services to which one may have recourse in case of a difficult pregnancy, after childbirth, illness, accident, handicap or old age. Totally private, doctors in private practice and in private clinics. The insured person has full freedom of choice among the recognized healthcare providers competent to treat the condition on the understanding that the costs are covered by the insurance up to the level of the official tariff. There is freedom of choice when selecting an insurance company to which one pays a premium, usually on a monthly basis. The list of officially approved insurance companies can be obtained from the cantonal authority. Hospitals. Statistics. Healthcare costs in Switzerland are 11.4% of GDP, comparable to Germany and France and other European countries, but significantly less than in USA. Benefits paid out as a percentage of premiums were 90.4% in 2011. Total gross benefits per person and per year in 2011 were 3,171 Swiss francs, of which 455 Swiss francs are cost-sharing. According to the OECD, Switzerland has the highest density of nurses among 27 measured countries, namely 17.4 nurses per thousand people in 2013. The density of practicing physicians is 4 per thousand population. In the 2015 Euro Health Consumer Index survey, Switzerland was placed second, and described as an excellent, although expensive, healthcare system.